my team. That's our project, Pri-Berry. Yeah. Myself, Asma, Stacy, Ville, sorry for wrong pronunciation, Matthias, and Karina. Well, they were really scared to come here. However, it's not that hard. It's very hard here. Well, our project is Pri-Berry care. It's mainly for primary care. Initially, it was an idea. However, we have worked together to implement it. So I'll show you how far have we reached. Is it working? Yeah. So our aim was to develop an app integrated with healthcare sensors and specifically for primary care. Objectives we set up for these 5 days after developing the idea was rigorous real-time data retrieval and storage, user-friendly interface to display, and we distributed all the objectives, tasks related to the objectives amongst all of us. These two focused on research, these three focused on programming and implementing the whole idea. Yeah. For the implementation, we thought of putting boundaries because he doesn't know what is delimits. Delimits is to set up a focused area so that because we don't have that much time to implement everything. So we didn't focus too much into security, achieving healthcare standards and accuracy of the data because we managed to get pulse rate 778, which is not too much. And we restricted our implementation for 2 sensors. Okay, so let's go further. Yeah. This was the components which we required for the idea to make work. We focused into home-house, like in-house solution because after doing a lot of research, we figured out it's at this stage we cannot focus for healthcare. However, it can be implemented for future. So the application which we developed, which is Pri-Berry care, it captures the real-time data and stores it. And as I said, it's for only two sensors for now. Okay, so database, app, and these were the sensors we were focusing, and that's our idea, our app. I also plan to implement identification, like we're using RFID so that we can just scan the tags and the whole database will be displayed. But because we don't have the sensors right now and we cannot do everything in like 5 days, so we just removed it. However, that's an idea. It can be implemented when we go back to our university and ask other students to work or see how it goes further. Yep. This was our team initially. Then all these guys, they helped us. They joined our team to implement it. So after this, I would like one of my team members to give you a brief about other research aspects, which is Ville. Forget it, please. Thank you.
Yeah, thanks, Obviously, we don't have those standards. Right there are medical directives and standards, and we're still looking forward. Are we going to need those in this device? Because we're not exactly sure. Are we going to want this machine to hospital world or just for fun for regular people? Well, even in a regular people use, if they got hospital standards, it would be good information then for doctors. Well, we're looking forward to that. And now, today we're going to measure two things. One is pulse, and for normal people like us, what could interest us is, example, resting heart rate, where we can measure if there's some overtraining or stuff like that. How's the condition today? and stuff, and the other one is blood oxygen, or oxygen in blood, and there's the levels, how it should be, so we're aiming here. Yeah, and the final system that we aiming to create, we would also have these measurements, or they are possible there. So with these measurements, you can pretty much do all kind of research for yourself. Yep. That's all.
Hello. Hello. I'll try to be less crazy this time. Some of the stakeholders that our system may have an effect on is receivers, so that's just the general public, you and I, who will be kind of the main users. Healthcare providers, this could be the doctors, the nurses, kind of the caregivers really that look after us. And the financial providers, so we have the NHS in the UK, which I'm going to be talking about soon. But it could be insurance companies as well. So we're going to look at a few of the benefits. So what would be the advantages for users at home? So if you're ill and you don't know that you're going to be ill, not everybody knows. You can't just tell what your heart rate is by just feeling it and just going, yeah, I think my heart rate's a bit high, or my blood pressure's a bit high. So potentially we could prevent long-term illness and stays in the hospital. So you notice these changes because we're capturing the data and looking at it. And then again, you don't have to visit the doctor because nobody can visit the doctor the amount of times that you could do it yourself. So there's a lot more measurements that you can take. And we did look at a study that kind of had an impact on people who actually took their own blood pressure. So that's kind of something that we could look into. So, we got a cute little baby. But our system, it kind of aims to predict. So by predicting, we could predict that something might happen. So for example, if blood pressure was to go up or oxygen in the blood was low, this could indicate that there may be something serious happening in a few days. Again, preventing bed days. So now I'm going to talk about the NHS, which if our system was implemented in the UK, I think it would have a big impact on the NHS. So do any of you know much about the NHS other than the people in the UK and what we get? So this is just a little bit about, it's just free services for us in the UK, and it's massive. And primary care is one of the main things because, like we said in the previous presentation, that primary care is kind of the instant, what's the word? Instant kind of, where you get your care. Yeah, that's the first point of contact. So we did some research on it's cost effective and sustainable to use our system. So this is how much CO2, like 380 kilograms, is produced by patient admission. That's just to admit someone into hospital. So by using primary care, that illness could have been noticed. So you could, there's a funny case study coming up soon, so I'll keep that a bit quiet. And the money, and we all know that big companies like the NHS are interested in savings and costs and money. And if we look at this pie chart, 48% of the carbon footprint for travel within the NHS is for patient and visitor travel. So we're helping to save money and looking after the environment at the same time. So here's our amazing case study. Does everybody know who the Queen is? No. Well, she's saying hello now. Moi moi. She's our Queen of the United Kingdom. And she does have quite a stressful job when there's people like me in the United Kingdom. So she could be prone to a bit of stress, which could bring on some cold and flu. So we're going to take primary care to the Windsor House. So she's not feeling so well. She's had a dodgy scone or a cup of tea. So how would she benefit? She doesn't have to leave the house. The servants can constantly monitor her because she's not going to do it herself. And she doesn't need to go to the hospital because one doesn't like visiting the hospital. And if there's a change detected, then action can be taken straight away. So look, she's feeling great and she wants a cuppa because she needed some antibiotics, and we noticed that there was a problem before it actually happened. So if we didn't notice that problem and she wasn't being regular monitored, she would have had to stay in hospital, and we saved the day. So she's going to go for a cuppa now. So with every idea, there's always constraints. This is Grumpy Cat, I love Grumpy Cat. And again, there are a few things that could have an impact. So medical knowledge. Now, the Queen's servants are probably, you know, they've got the brains, but you know, not everybody is good as our doctor over here, who's going to tell us a bit more about the readings shortly. And inexperience, so some people might not trust computers, etc. So there's still constraints that will be quite hard to get over. And again, how do we know that the readings are accurate? Are they taking the readings right? Is the computer working? Are people reading them correctly against the optimum? So we've got a demonstration, but before we start, could you tell us about how we could get inaccurate measurements?
Shall we do the demonstration, guys?
Yeah, we can go.
Yeah. Well, we'll hope our prototype is going to work, but before we do the measurement, we should check a few things that what might cause effects to the well, I can explain it.
You can see.
Yeah, what might cause effects to the actual measurement. So now it's like daytime after lunch. It might cause effect there. How's the physical activity of the who's going to get the yeah? How Mr. E?
Okay, so we made an app and we can add a user, but I'm not going to do that right now. Matthias is doing the measuring. We connect the Raspberry Pi and the sensors to the app. So when I'm pressing on Matthias, we get nothing. Yeah. So when okay, so we have a live feed of his pulse rate, and you not how to see that? I think.
There we go.
Oh, there it is.
It's alive.
As you can see, he's a little bit stressed. I'm not sure why. And the results are stored in a database. So this is the oxygen, and he is dead right now. So let's go downstairs. And
50.
so yes,
56.
so that is pretty normal, right?
Not
90,
me, doctor, please say.
97. And when I go to the pulse, he is now
Yeah, a little bit stressed.
Yeah.
Presentation.
So that are the only sensors right now in the app, but in the future they can put all the sensors in it.
Let's hope the computer works.
Yeah, if we bring this machine to the customer, they need to know what cause effects to the measurement. As we saw, Matthias was a little bit stressed, and yeah, so that raised the heartbeat and stuff. And also, what could also cause the stress is like maybe stressing environment and a little bit temperature is a little bit high. And yesterday's medication, I don't know. How was it?
Yesterday's medication.
Yeah. Okay.
Well, as you can see, the application is not that user, the interface is not that developed. However, we tried but just because of lack of time, we couldn't do it, so we had to stop where we are so that we can manage to do the demonstration. However, we are aiming to improve it with better GUI and see how we can use the database and how it can help the patients to maintain their records with all the sensors which we need for primary services. So that's our idea, and that's it. Any questions?